15 early signs your liver is in danger that most ignore. 1. Abdominal swelling and bloating. Abdominal swelling and bloating. If you notice your pants are fitting tighter around your abdomen for no reason, it could be a red flag for liver inflammation and damage. As your liver becomes more inflamed, it can cause fluid retention and swelling in the belly. This is called ascites, and it indicates that your liver is not processing fluids adequately. Pay attention to any abnormal abdominal bloating. 2. Skin and eyes turning yellow. Yellowing skin and eyes, known medically as jaundice, indicate that your liver is not properly producing and excreting bile. Bilirubin is a yellow pigment created when old red blood cells break down. Healthy livers remove bilirubin from the blood, but damaged livers allow it to build up and leak into the skin and whites of the eyes. Jaundice is an obvious liver symptom to watch out for. Catching it early is crucial. 3. Dark urine and pale stools. Liver disease disrupts the organ's ability to produce and secrete bile. This causes bilirubin to be excreted through urine, making it dark in color. At the same time, pale or clay-colored stools occur because not enough bile reaches the intestines to give stool its normal brown hue. If you notice your urine becomes darker and your stools become increasingly pale, have your liver tested promptly? 4. Unexplained fatigue and weakness. Feeling unusually exhausted for longer than 2 weeks with no known cause could indicate liver dysfunction. Your liver is responsible for processing nutrients and removing toxins from the blood. When the liver is inflamed and damaged, it struggles to properly energize the body. Lingering weakness and fatigue is one of the most common yet overlooked symptoms of liver disease. It's crucial to investigate the underlying reason. 5. Nausea, diarrhea, and frequent illness. Because the liver produces bile to help digest fats and rid the body of toxins, liver damage can cause digestive issues like nausea, diarrhea, and poor appetite. If you feel sick after eating fatty or oily foods, it could be a sign of insufficient bile. Moreover, the liver helps fight infections, so people with liver disease often get sick more easily and recover slower. Digestive troubles and frequent illness are signals of an unhealthy liver. 6. Insomnia and irritability. Sleep disruptions and mood changes like unexplained insomnia, irritability, anxiety, and depression can develop due to liver inflammation. The liver plays a role in balancing hormones and chemicals that enable restful sleep and emotional well-being. When liver function is impaired, it can affect levels of serotonin, cortisol, and melatonin, causing sleep and mood issues. If these problems persist, ask your doctor to check your liver. 7. Spider-like blood vessels under skin. Another visual warning sign of liver damage is spider angioma, enlarged blood vessels under the skin's surface that look like a spider. They are caused by swelling of localized minor blood vessels. While generally harmless, spider angiomas that keep spreading can indicate chronic liver disease. If you notice reddish spider-like veins around your body, point them out to your physician right away. 8. Itchy skin, rashes, and bruising. Itching and skin irritations are common symptoms of liver disease. Damaged livers struggle to remove bilirubin and bile acids from the blood. Elevated levels of these can cause yellowing and itching. Easy bruising and slow wound healing after injuries are also common when the liver cannot make enough clotting factors. Pay attention to unexplained skin changes as they may originate from unhealthy liver function. 9. Weight loss and loss of appetite. Sudden, unintentional weight loss of over 5% of your body weight in 6-12 months could signify a sick liver. It may stem from a lack of appetite, nausea, fatigue, or inefficient nutrient processing. Liver disease disrupts essential roles like managing glucose, fat, and protein metabolism. Evaluate any major shifts in weight or eating habits as they tie into liver health. Gradually losing weight without trying also warrants medical investigation. 10. Upper right abdominal pain. Tenderness or a dull, throbbing pain in the upper right torso can be felt when the liver is inflamed and enlarged. The swelling puts pressure on surrounding nerves, causing discomfort. It may also feel like a stabbing pain if a liver cyst or mass is present. Upper right quadrant pain, especially after eating fatty foods, is a classical characteristic of liver disease. Report persistent pain in this area to your doctor promptly. 11. High liver enzyme levels. Some of the earliest indications of liver damage show up on blood tests. Elevated liver enzymes including ALT, AST, GGT, ALP, and bilirubin signify liver injury even before symptoms appear. Make sure your annual checkup includes liver function blood work so problems get addressed in the beginning stages. Early treatment can often resolve mild liver damage before it progresses. 12. Excess triglycerides in blood. Having high blood levels of fats called triglycerides is linked with NAFLD or non-alcoholic fatty liver disease. When too much fat accumulates in liver cells, it shows up as elevated triglycerides on lab reports. Tracking and managing this number is key, as fatty liver can lead to cirrhosis and liver failure if left unchecked. Work on lowering triglycerides through diet, exercise, and medication if needed. 13. Iron buildup in blood. Iron overload is another blood abnormality that injures the liver. Having too much iron circulating in the blood, measured via tests for ferritin and transferrin saturation, can cause excess iron storage in the liver. This leads to cellular damage, inflammation, and scarring. People with hemochromatosis or other conditions causing high iron should monitor their levels closely to avoid liver complications. 14. Heavy alcohol use. Consuming more than 1 alcoholic drink per day for women and 2 for men heightens the risk for alcoholic liver disease. Excessive alcohol usage over many years can initiate fatty liver, hepatitis, and cirrhosis. While the liver can handle limited alcohol intake, consistent heavy drinking is very taxing on liver cells. If you drink regularly, get your liver function tested to catch any indicators of damage early. 15. Obesity and metabolic disease. Being significantly overweight and having conditions like diabetes and high cholesterol are tied to non-alcoholic fatty liver disease. Insulin resistance, diabetes, and obesity promote fat accumulation and inflammation in the liver. These factors also speed up liver scarring. Shedding extra weight and managing metabolic issues are key to reversing the damage. Engaging in a holistic approach to wellness, including adopting a balanced diet, exercising regularly, and monitoring blood sugar levels, can mitigate the risk. Get your liver screened if at high risk, as early detection and intervention play a crucial role in preventing further complications and safeguarding your long-term health. Have you noticed any of these 15 symptoms? Do you get your liver function tested regularly at annual checkups? Let me know in the comments below. A healthy liver is crucial, yet often overlooked. Pay attention to your body for the subtle signs discussed here. Seek medical advice if you have ongoing digestive troubles, fatigue, abdominal pain, or high liver enzymes. Taking action early provides the best chance for preventing serious conditions down the road. With treatment, mild liver damage can be reversed before it's too late. Don't forget to like, share, and subscribe for more vital health content. Stay happy and healthy, friends. Disclaimer. This content is for informational and educational purposes only. It is not intended to substitute professional medical advice, diagnosis, or treatment. Seek help from your healthcare provider for any liver issues.